Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Sylvia Mwesigye has been living with her husband for 10 years now. Mwesigye and the husband have spent the last 5 years trying to have a child with no success. Their earlier attempt ended into a miscarriage in 2015.
They did a scan. Then the doctor told me I have fibroids. But he told me you don't need to worry because they are still small, and where the position is not so bad.
Not so bad because according to science, the position of fibroids in the uterus bears different resultant effects to a woman. Dr. Gonzaga Andabati is a fertility expert and gynecologist at Bethany Women's and Family Hospital. He explains why the position of fibroids matters.
Those which are inside will present with heavy periods. They are more likely to be associated with miscarriages. They are more likely to show symptoms in the early stages when even they are still small. Yes. Those within the muscle wall tend to take some time before they show up. They have to become a little bit bigger to show up. Those on the outside many times almost don't show themselves. They are found accidentally on routine examination.
Again, science has no exact cause of fibroids, but Dr. Andabati says they know of some risk factors.
It's actually a collection of cells. Most times the cells are, the cell which starts are not many. They're like 1 or 2 cells. It keeps on multiplying and then becoming bigger and bigger. We know that there are some genetic factors. That means you will have this condition run in families. The other thing we know is it has a close association with age. Especially, it's more common above the age of 30 years. Now, with also age comes a long period when you are not getting pregnant. People who have abnormal high levels of some of the hormones, like estrogen, progesterone, for some reason, if they have that situation, they're at a higher risk of developing these fibroids.
There are no conclusive studies that have been conducted here in Uganda about fibroids, but fertility experts say it is now a common health complication.
On average, between 25 to 30 in a month, I see, and of course, out of those, about 15 to 20 of them would need treatment.
Because of the asymptomatic nature, many women live with fibroids unknowingly, but a few will have some sort of symptoms.
They start feeling things like feeling a mass in the abdomen, in the lower tummy. So how do you know you have a mass? Maybe you were having some skirt or a trouser. This time it is failing to fit. Or you are bathing and then you touch your belly down here, you notice, there's something hard here. Yes. Or sometimes that mass starts pressing on your bladder. So you find you're passing urine very frequently. You know, that can be the signal. In some of them, they start having heavy periods. Some people have miscarriages, especially if the fibroids are hanging inside the womb.
Fibroids can be detected during routine health checks. Dr. Andabati also advises that once you feel the symptoms, it is best to seek medical attention.
An ultrasound scan, that is the ultimate confirmation of the presence of a fibroid, because it can see even smaller fibroids.
Health experts say the complication is sometimes stigmatized. And one of the major problems they face is having to deal with the emotional and psychological stress it causes to the patients.
Each time you try something and it doesn't work out, of course you feel stressed, you feel depressed.
They think about, many things, including the effect on fertility. They think about, will it turn into a cancer? Is it going to destroy the womb?
My husband is a very understanding man, and he has been supportive all the way through this process. Maybe the only stress we have had is financial stress.
What the social burden also brings in is the different myriads of intervention now in the population. Apart from the mainstream medical treatment, There are thousands of people around, millions of people who are treating fibroids.
Mwesigye also fell for the enticing herbal treatments on the market, only to be disappointed.
I took herbals like for a year, that is 2017. On testing in 2018, they told me they had increased now to 7.
In next week's episode, Dr. Andabati will explain treatment and post-surgery care for fibroids. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.